Hello, AMP Honors Program. I'm back with my clinical apprenticeship series.
Welcome to another presentation from the CV Academics Foundation, home of the AMP Honors Program.
I knew it was going to be a good day because the first patient of the day had shared the same birthday as me, so that was a cool thing to see. I've seen it before, actually, quite a few times, but more than you'd think. But it's always a little extra special when you see it. And that guy actually had a pretty interesting case. Not the most interesting case of the day, but a pretty interesting case. He was having some elbow pain for the last 4 months. He was in there generally for a physical, but he mentioned this elbow pain. It's like a 3 to 4 out of 10 pain at baseline now, and it's a little bit worse with using it. I did some of my own physical exam testing, and then my preceptor came back and did some better testing, and we figured out, we think we know what it is, and it's either a medial epicondylitis, which is a fun word to say, or tendinopathy, or maybe a little mix of both. He had some kind of inconsistent history. There was he had pain with a lot of different movements, like pronation he had a lot of pain with, and supination he had less pain with, which is like you're holding a bowl of soup. He had pain with flexion of his arm at the elbow, so like a curling position. So there's a lot of different things. That's why we weren't able to kind of nail down one specific diagnosis. Next case though was the most interesting case of the day. The rest of the day was a lot of physicals, nothing too crazy. Some spinal stenosis in my last case. Anyways, now what you've all been waiting for, the most interesting case of the day. 46-year-old patient come in with 10 years of worsening suprapubic abdominal pain. Now recently, within the last 3 or 4 months, some pulsating pains that he said are much more painful, that will last for about 5 minutes at a time, and they'll pulse. It'll be like a pulsing, he described as a throbbing pain, like once every 4 seconds or so. He noted that it was a little bit worse with exercise or with exertion, but as far as bowel movements or urination, there wasn't a huge difference. He said sometimes avoiding urine and also having a bowel movement would help and relieve some pain, but other times it wouldn't really. So it wasn't really consistent there. He said he wakes up just about every night to some pain there. He's able to go and void urine. Sometimes he's able to get back to sleep after that because the pain goes down, sometimes not. We didn't really know where to go. There wasn't very much tenderness when we pushed on the suprapubic area or anywhere else in the abdomen. He didn't report any pain while urinating or any hematuria. Even though he did have a history of hematuria, he hadn't had any within the last 10 years. I think his last bout of hematuria was 10 years ago. He also had a history of renal calculi, but that also was found about 10 years ago, and he hasn't had that many issues since. So we weren't exactly sure where to go with it, but we decided to send him to the lab to get a PSA, which is a prostate-specific antigen test. That's a good way to test for prostate enlargement. We also ordered a UA, a urinalysis, to rule out infection, especially of the bladder, and to look for hematuria as well. Even though he hasn't been reporting dark red blood or anything when he pees, it still could have remnants of some blood in there. So we checked for that. We also just got a blood draw to check for, especially for the white count, which is the white blood cell count, to see if that's elevated. That's another tipper for infection. My preceptor thought initially that it's probably either interstitial cystitis or chronic prostatitis. So I hope you guys enjoyed. I hope you guys will continue to keep an eye out for my future clinical apprenticeship videos. There will be more this semester because we got another 7 or 8 classes, or sessions I should say. So yeah, stay tuned and see you guys on the platform.
This has been a presentation of the CV Academics Foundation, home of the AMP Honors Program.